Thank you, Don. So I want to talk just for a few minutes about obesity from the employer's perspective. You might ask, well, why are employers important in this? As you can see here, employers represent the largest single segment of healthcare coverage of any entity. We often talk about health plans as payers. The employers are the payers. The money comes from them and from taxpayers, and from taxpayers for other programs. So the employers represent the largest single segment of this world. But as you can see here, that less than 30% provide coverage for obesity in the commercial sense. So we have employers in a very dominant and important role in healthcare, but as we can see, obesity coverage is certainly a challenge. Now, I'm part of an advisory group on a study called the Action Study that has been supported by Novo Nordisk. Ted and Joe are also part of the advisory group on that Action Study. It's unique in that it includes, in the survey design, 3,000 people with obesity, 600 providers and practitioners of care for obesity patients, and 150 employers. So it combines those three entities into a single study. The first manuscript will be submitted for publication soon, and there'll be several other manuscripts as well. So a couple of highlights, and some of this information was presented at Obesity Week in November in New Orleans. Several highlights. First of all, 2/3 of employers believe obesity is a disease. It's a very important starting point if you're going to talk to employers about coverage. Secondly, 85% of employers agree that a 10% weight loss would be extremely beneficial to employees with obesity. And I think the third point here, which is a growing challenge, on the one hand, 70% of employers believe that wellness programs they provide are valuable to employees, but only 17% of people with obesity believe the employer's wellness programs are effective for them. And this really, I think, represents a key challenge for people with obesity and employers when they think about wellness. Employers think about wellness to a great extent in things like eating habits and gym memberships and exercise and the like. People with obesity are looking for a far broader, more holistic approach, more of a well-being approach to wellness than I think many employers are engaged in today. And this is where, of course, the challenge comes in. So what are the concerns of employers about obesity? And as you can see here, it's about the cost of care. Somehow it always comes down to the money. So over half the employers, when they're asked about your concerns, it's about the cost of care. And employers are getting ready for an onslaught of costs around specialty pharmaceuticals. And that really is influencing the way they think about coverage from a variety of other key chronic condition standpoint. So cost of coverage, if we don't effectively deal with the question of cost of coverage, then we'll really never get the employer's attention about this issue. Now, for some other work we've done with Ron Kessler at Harvard Medical School, Ron worked with the World Health Organization to develop a research-validated self-reporting tool called the Work and Health Performance Questionnaire. And we have data on about 100,000 employees in that database. And the database asks a series of questions from the employee's viewpoint. And one of the things we learned is, from the obesity standpoint, about 2/3 of the employees with obesity have never been treated. So here we have a very prevalent condition in that population, and 2/3 of those people say, we've never gotten care. And this represents, of course, a critical challenge for employers, because as long as employers think of this as a cost, then this idea of we should increase treatment penetration is a real challenge. Because what, of course, happens to costs when more people get care? In the short term, costs increase. So the challenge for the employers in dealing with this issue is if we work to get access to care to these people, our health care costs will go up rather dramatically, at least in that segment. So where's the answer to this? And I think from the employer standpoint, and this is research that we published in working with a team of researchers from the American College of Occupational and Environmental Medicine and Harvard University. So we worked with 10 very large employers, and we got all the medical and pharmacy claims data, and for those same employees, they participated in Dr. Kessler's Health and Work Performance Questionnaire. And that questionnaire asks questions not only about the conditions that these employees have, but it also asks questions about the other key outcomes of health that are important both to employers and employees. Absence from work. It's a key consideration around health issues for employers. When people don't come to work because they're in poor health, the employer has a real problem. And this other outcome of health, what is termed in the research literature presenteeism, which is simply a measure of performance at work around health. So when we bring these data together and we monetize the productivity impacts of absence and performance, we get a very, very different view of what's important from this total cost perspective. So from the standpoint of obesity, if we just look at the medical and pharmacy spend, obesity is not on the radar screen for most large employers. But when we bring in the productivity impacts around these different conditions for these 10 employers, obesity moves to the second most important condition from a total cost standpoint to employers. So if we are going to get employers engaged in this conversation, we have to do a couple of things. One, we have to help employers understand that the window into what's important cannot be gleaned from only looking at medical and pharmacy claims data. Other sources of information have to be part of that view. And we have to help employers connect the dots into these other outcomes. Now, as it turns out, these other outcomes like absence from work and performance are particularly germane to chief financial officers and CEOs, people running the business. And the degree to which we can link these data sets and demonstrate that good care is going to lead to better outcomes that drive business performance, now we've got a conversation that the employers are willing to listen to. So in summary, it's not a situation where we can argue that more cost is good, but it is a situation where we can argue that getting care is going to drive better outcomes, including costs. Thank you very much.